So as Jeannie said, I wear many, many hats. I've been a physical therapist for 40 years, and I've treated a lot of different people. I started specializing in Parkinson's disease about 12, 13 years ago. About 10 years ago, I went to home health, and I saw a need for people that need home health. This topic is near and dear to the Parkinson's Foundation. They've really started a hospital initiative, and it's evolving over time. It started off as the Aware and Care. I became an Aware and Care ambassador. Now I'm actually hospital lead for California, which I have too much on my plate. But the problem is there's a lot of issues with hospitalization. So I'll give you some statistics. We'll start off. So this is a part of, so the main thing, you need to understand that there are risks with hospital stays. Whether you go into the hospital for a planned stay, an emergency stay, there are risks for people with Parkinson's, especially, for hospital stays. You need to have the tools to help be an active participant in your care, or for your loved one to advocate for you, right? Or your, whoever your significant other or your family. You need to be prepared, and you need to know what to take to the hospital with you, and what are the strategies to get the best care. So how many of you have been in the hospital since you were diagnosed with Parkinson's? Have any of you been hospitalized? Yeah? Okay, so did you have any issues getting your medications on time? Oh, I got a yes back there. Yeah, so when we think about the issues with hospitalization, we think hospitals know, the people in the hospitals know everything. We think, okay, they're going to call my neurologist. And how many of you are on a fairly complicated schedule of medications, more than one Parkinson's medication, and you take it at a certain time, and it's a lot to manage. That's a lot of what we do in home health. We help people figure out those med management issues. Your neurologist is not on staff generally at that hospital, so they can't come see you. And it's really hard to get the hospitalist, who's primarily going to be seeing you, to call in specialists. So you may be seeing a neurologist, but it won't usually be your neurologist. The pharmacy will have my Parkinson's disease meds. May or may not. You may be on, a specialty med. You may be on not just carbidopa, levodopa, but Rytari, or something that the hospital doesn't staff in their pharmacy, okay? You think all those nurses, all of those doctors know everything there is to know about Parkinson's? It's a very complex disease. So they may have a general understanding, but they don't know very much. A lot of them don't know a lot. They're going to bring you your meds on time. So we'll talk a lot about that, because that's one of the big problems. They have schedules of when they pass meds. That's the hospital schedules, not your schedules, right? And they're also going to know which drugs are unsafe or contraindicated, or with you and your disease and your Parkinson's medication. So those are things that you think going in, but actually really aren't true. So when people with Parkinson's go into the hospital, number one, they go to the hospital more often. So 40% more often than people without Parkinson's disease. So number one, your risk is higher because you're going to have a bigger chance of going to the hospital. Number two, people with Parkinson's end up staying longer. So your length of stay is longer. So think about this. You're going to stay 2 to 14 days. So most of the time they try to get you out of there as quick as possible. But typically you stay longer, and unfortunately, there's avoidable complications, and happen more often in Parkinson's than without Parkinson's. So lots of problems with people with Parkinson's, and people with Parkinson's don't get to go home as often, all right? So only a third get to go home, and 2/3 are getting sent on to skilled nursing facilities, rehab facilities, other care. Compared to people without Parkinson's, that's a huge number, okay? When really the best place for you is home. We all know that, right? So there's also a higher mortality rate, a higher rate of death. So there's 3.94% mortality rate. So there are issues that can be life-threatening that do happen. So think about 12 people with Parkinson's. 4 of them are going to go to the hospital this year. We in home health, we see a lot of people that go to the hospital multiple times, which is what we're trying to avoid. Out of those 4, 3 of the 4, 75%, will not get their right medication on time. And of those 3, 2 are going to have complications. So 2 out of those 12 are going to have some significant complications, even if they go in for something really simple. So what happens? Why does this happen? Number one is your medications are complicated. Oftentimes they're missed. They're missed by error. They don't have them in their formulary in the pharmacy. They try to, they just don't, it isn't listed sometimes, right? So we're going to talk about strategies. How many of you carry a list of meds in your wallet or with you in your purse at all times? Okay, now start of COVID, my father-in-law had pneumonia. My mother-in-law had to dump him off in the front in the white tent. He didn't have his wallet. He had no ID, no insurance card, no med list, no nothing, and she couldn't go with him. Okay, so they had to treat him with no information. So you don't want that to happen. Oftentimes, it's incorrectly withheld or admitted, especially when you're going in and you have to be NPO. There's a lot, or they think you have a swallowing problem as the other. If you have a little bit of a dysphagia or swallowing problem, maybe you've worked with a speech therapist and you know what you need to do to swallow, but they're going to become fearful and say you can't swallow. We want to put a PEG tube in or a feeding tube in or an NG tube in to help. The scheduling, so the delayed. So in reality, you should get your Parkinson's medications within about 15 minutes of that time that it's scheduled. Otherwise, it starts creating problems with your, that Parkinson's medications typically have a bell curve. It takes a little bit to get into your system to be really effective, and then it starts to wear off. And some people have more problems with wearing off than others, but they have a bigger window, right? It's a 1-hour window, and it's on their timing, right? Not your timing. And then sometimes they'll substitute. So they don't have Rytary. They don't have the long-acting, more expensive drug. They give you regular carbidopa-levodopa or extended-release carbidopa-levodopa. It's a different drug that you may react to differently. So there's lots, and some people do have trouble with generic versus the name brands. So that's the big issue there, right? So we think about it. Your medications are what allows you to keep functioning, to keep moving. So if you don't get your medications, it's like a diabetic that doesn't get their insulin. You can crash. So people that don't get their medications can if they absolutely don't get them, they can end up in the catatonic type state, right? They can't move. They're so stiff, they're so slow, they can't move. So it does other things a little bit. You can have trouble with other things as well, but the big thing is moving. You can't move, and you become your Parkinson's symptoms get worse much faster. You'll have an exacerbation. Anytime you're in the hospital, typically your symptoms will get a little worse because you're a little more immobile. But if you're really immobile because you're not getting your meds, then your symptoms, you're going to really have a big downhill slide. So why is it happening? So there's a lot of lack of awareness. There's not a lot of specific education. In Europe, they have Parkinson's nurses. We don't really have Parkinson's nurses here, right? There's a recommendation that you see a Parkinson's specialized physical therapist, but there's not like a standard of what that is. To me, that means you've taken extra training, like you're an LSVT or Power Moves therapist. You take LSVT Big or Speak Out if you're a speech therapist. You get extra education because the bare minimum is what you get in school. So that lack of awareness that it's really poorly managed Parkinson's is really significant, and you have serious, serious side effects. And it's actually unsafe. The other one of those big issues, how many of you have had some issues with a little bit of hallucinations or delusions? Hallucinations are really common, where you can have visual or auditory hallucinations. They're quite common in Parkinson's. Sometimes your medications may be part of that problem, but a lot of the medications that are typical antipsychotic medications are really bad for you if you have Parkinson's. They're contraindicated. So here you are in the hospital. You're not getting your meds on time. Maybe you're getting a different version of them, a different type of meds, and you're starting to not be able to respond and move, and you get too stiff, or maybe you start having some hallucinations and delusions, and they want to give you an antipsychotic that is actually a dopamine depleter. What's your problem with Parkinson's? You don't have enough dopamine. You take dopamine replacement medication and things to make your dopamine work better. So if they give you a medication that depletes dopamine, what are you going to be able to do? You're going to really have trouble, because then you're not going to be able to move at all. So everything that we need to think about, you're all unique. You all have a different combination of meds, a different timing, a different schedule. You respond differently to everything. No, they don't even know at this stage. They're trying to decide if Parkinson's is one disease with lots of different heterogenic variability, or is it all these other related diseases under a big umbrella? That's kind of where they're looking research-wise. You're the best person to know your symptoms, your schedule, how you respond to everything. And if you have a care partner, that's great. If you don't, then you're going to have to figure out how to be your best advocate. So you need somebody that's going to have this information. We're going to get a kit. We're going to go through the kit. If you are a single person living alone and don't have someone, then you're going to need to figure out a way to designate somebody to help you with this. If you end up in the hospital, somebody's going to have to advocate for you. And there's a lot of good information in this kit that we're going to go over. So I'm doing this job of talking to people with Parkinson's and care partners, right? But we also have to educate healthcare providers and hospital systems. So what would be perfect is if the hospital systems had in their medical record system a way to flag people with Parkinson's, a way to get that information out to everybody. That's what needs to happen. And it's happening in little pockets around the country, but not everywhere. And we need to do more training for the staff as a whole. So there's lots of stories. Okay, the doctor was about to give me Haldol. So Haldol is the traditional antipsychotic. It's the first drug with people that are having hallucinations, delusions. It's a dopamine depleter. It will make you very, very worse. So recently I had a guy saying they did that. He ended up in the hospital, ended up in the SNF, ended up on hospice really quickly. Should not have happened, but probably was because of the Haldol, 2 nights of Haldol. And nobody caught it, right? Nurses, it's not their fault. They need more education on this, right? But they don't always know. So to be prepared ahead of time, we're going to go through the kit. We're going to talk about this. I'll give you cards. People can send away for more kits if they want. I have some Spanish kits as well, too. And then the Parkinson's Foundation on their website has all kinds of information. So I've got them for you, but we're going to, I've got lots of resources for you to get them. So I'm going to start there. I'm going to give you all a kit. So let's take a little look at this nice little kit. Do you have to take this with you? No, you could have another way to collect all this information. But when people see this, it's like, oh, you have Parkinson's. This is your go-to kit for when you have to go to the hospital. So it's got a lot of different things in it. If you're looking in there a little bit. I'll start with what's on the top of mine. There is a bracelet there that just is an awareness bracelet. So especially if you're out and about or you live alone and people may not know that you have Parkinson's, that's a good thing to wear. A lot of times if you have dyskinesias, does anybody here get dyskinetic a little bit when they're on their meds and they get to moving around and people think, oh, you look like you're drunk sometimes, or they don't understand what's going on. So sometimes just having that awareness that you have Parkinson's is important. So there's a little card, right? A medical alert card. So find your medical alert card. It says, I have Parkinson's disease, which could make me move slowly and have difficulty standing or speaking. I am not intoxicated. Please call my family or physician for help. And it has on the back your place for your information. This you should carry in your wallet. It's not meant to stay in the kit. It's meant to go in your wallet. All right? There's some important information talking about why you need your medications. You need them on time. You shouldn't stop taking your levodopa therapy. You should not take, if you need antipsychotics, it's Nuplazid or Seroquel, quetiapine. I don't know if anybody's on any of those, but those are the standard medications for that, or Clozaril. And it tells some of the contraindications, right? So this is for you to carry with you. And there's an even bigger, better thing about medications on the back. Does anybody here have a DBS, a deep brain stimulator? So if you have a deep brain stimulator, you can't go into an MRI. You have to turn it off to have certain testing and things done. So it's really important that people know that you have a DBS. Usually, a healthcare provider will be able to feel the battery pack and the lead and know that there's something going on. But that's really important. So that medical alert card is really good for you to carry with you. The hospital action plan is your go-to. So it tells you a little bit about how to use a lot of these different things. And all the stuff we're talking about is going to be in that booklet for you. So there's a checklist in there, what to do for a planned hospital stay, what to talk to your doctor about for anesthesias, because certain anesthesias are better for you than others if you have Parkinson's, and then the different considerations. So this is sort of like the guide and the checklist of what to do. If we look at the other things that are in here, so if you had a DBS, you would want to make sure this card was something that you had out when you went into the hospital, and that a lot of people don't know what it is. So a nurse might not even know what it was, right? A doctor, you need to be sure they know that. I think the medical device companies give you something to put in your wallet that tells them what kind of DBS you have and all of that. I don't think anybody here has a Duopa pump, but that's another way of getting your Parkinson's medication. I know a couple people up in San Luis Obispo County who have a Duopa pump that's an intestinal gel, and it works really well for people that have a lot of on-off time, and so they just get a continuous little bout of carbidopa, levodopa all the time. But it's information about what your healthcare providers need to know about a Duopa pump. There's a medication sheet, and there's several forms of that medication sheet. Now, do you need to fill this out? If you type up one and you keep it up to date, you don't have to use this one, but you should have one in your kit and in your wallet, right? So if you fall and you're out in the community and they come and take you to the hospital, you want to have your medication sheet with you, right? And then something like that, your designated person, whether it's your spouse or your caregiver or a friend, should be able to bring you that aware and care, your kit to you when you get to the hospital. But this is really important to have this information. Okay, and this is nice because it's got your primary physician, room for your pharmacy, your primary physician, and things about, do you have hallucinations as a rule? It's not a new symptom. That's something you always deal with. Do you have trouble swallowing? So it helps give a lot of information. So there's multiple copies in there to be filled out. And then you have this these tear-off sheets. So when you're going to have different nurses every day, right? Even if they do 10-hour shifts, 12-hour shifts, you've got to have 2 different nurses, and they're not going to work 7 days in a row. So this is what you're going to hand to your healthcare providers, your nurses, your doctors, the x-ray techs, whoever needs to know about Parkinson's disease. And it lists all these critical things that they need to know about with needing your medications on time, that they can't skip them, that you need medications that are contraindicated. It talks about the symptoms. So on the back, it talks about slowness of movement, bradykinesia, decreased ability to swallow, dysphagia, freezing. How many of you have some freezing problems where you get stuck and you can't move, okay? Or the lack of facial expression. So that masked face, and I read some statistics that it ends up being almost everybody with Parkinson's, 90-something%, end up with that masked face. It's bradykinesia in your facial muscles. So people don't know how to read how you're feeling, right? It's hard for them to understand how you feel and whether you're in pain or whether you're alert or not a lot of times. So your stiffness, rigidity, your soft voice, stooped posture, tremor, balance, falls, all of those are motor symptoms. And then you've got anxiety, constipation, depression, hallucinations, blood pressure issues, pain, all kinds of things, right? That's all those, the non-motor things that are actually more disabling a lot of times than the motor things. So this is meant for you to hand to people, to give to them, for them to read, and have at bedside, okay? What other things besides meds, if you're in the hospital, what else do you think is really important that your doctors know? Nurses. Any ideas?
Getting up and exercising.
Yes, exactly. So one of the biggest problems with being in any kind of hospital facility is they don't let you get up, right? And they won't let you get up without therapy. The nurses won't get you up. You're stuck in bed. That's the absolute worst thing for a person with Parkinson's is to be immobile. So you need to get up, you need to move, you need to be moving 3 times a day while you're in the hospital. They need to call in PT if they need the PT to clear you to get up and walk with somebody. You have to advocate for that because it's easier if you just stay in bed and they don't have to worry about you, right? So that's really important, that movement part. And that other kind of big thing is the swallow. If you have any kind of swallowing issues that maybe, is going to be increased by anesthesia, being in the hospital, then you need to be able to say, hey, have speech therapy, come talk to me, before you start making me MPO and putting a tube down my nose, So there's things to do, but you have to ask for it. They're not going to know if you don't ask. So movement is really important, that physical therapy part or getting you moving, and then that speech therapy part. OT helps with getting you moving as well too. So ask for that as you can. Now, the big thing, so this is the fact sheet for nurses. I don't know what else is on here. The medical alert card, the medication form. All right, so let's, DBS, DUOPA. So let's go back to this, oops, I lost it. The hospital plan. So what do you think's the solution about getting your medications? Any ideas? Yeah. Did I hear somebody say bring them from home? Okay, so yes, that is the recommendation. Huh?
Do they even let you bring your own medication anymore? That's the big issue.
That's part of what this kit is for. In this kit, you need to treat this like your emergency kit. And you need to have it in the original bottle, 2 or 3 days worth. You need to bring it. You need to show it to them and say, they have to take it to their pharmacy and get it approved. And sometimes they'll let you have it back at bedside. Sometimes they'll let your care partner, if they're going to be there, give them. Sometimes the nurses will do it, but they have to be in the original, has to be in a prescription bottle with your name, and it has to be relatively up to date. So most people that I talk to in care groups, they treat it just like at the end of the month or when they get their new pill bottles, they fill their pill boxes and they kind of switch it out and they put 3 days worth of their Parkinson's meds, those are the important ones, in that bottle and they leave it there. And then when the next month when they get their new ones, they use those older ones and keep that supply fresh. But you have to have the original bottle with your name and the dosage. The other thing that's really important is your dosage should have timing on it. All right? So if it says take carbidopa, levodopa, 25-100, 2 tablets, 3 times a day, what do you think they're going to do? They're going to give it to you 8 hours apart. So whatever their schedule is in the hospital, maybe they give it to you at 8 and 4 and 8. That's 3 times a day. Is that when you take your Parkinson's medications? Probably not, right? You tend to take it 4 to 5 hours, 4 to 6 hours apart, starting when you get up, to have that dopamine in your system to help you keep moving. And then at night, usually if you need it at night, it's a long-acting to help you sleep better, get up to go to the bathroom, do those things, and not be so off when you wake up. But you don't take it on that 8 hours apart. But if their bottle says 3 times a day, that's what they're going to do. And you're going to have a really hard time convincing them to do anything else. Okay, so that's another thing to talk to your doctor about. Make sure your prescriptions give give that timing. How many of you have a PRN dose you can take? Like if you're really off. Some doctors will do that. They'll say, okay, here you can take it on this schedule, and then if you need another one, you can take it. Does anybody here take a rescue medication like an Apokyn shot or a Inbrija inhaler? Any of those? No? Okay, so those are medications that are as needed that you can kind of use to give yourself a boost in between regular doses if you're freezing or you're getting so turned off, right? The inhaler is carbidopa levodopa. The shot is apomorphine. It's a dopamine agonist. So those are all things you got to think about, right, if you go into the hospital to plan. But you can take your meds. I cannot guarantee you, but if you have, one of the things I was reading from Dr. Okun, Dr. Okun is head of the Parkinson's Foundation. He's a wonderful movement disorder neurologist in Florida. And his take on this is when you're in the hospital, talk about length of stay. Talk about things that matter to the hospital. Talk about how you can help. Be polite, be respectful, try to offer to be helpful. If you don't want to attack the people that they don't, how come you don't know my meds, right? How come you don't know this? Provide them that information in a gracious manner. And that's part of what this toolkit helps you to do, right? You have a way now to say, hey, I have Parkinson's. I really, need your help. And I would like to help. And if I, typically this is what happens. If people with Parkinson's don't get their meds, they have longer lengths of stay. They don't want that. They don't get paid if you get, for those longer length of stay. So they want to get you out and back to your home environment as soon as they can. So you want to try to partner with them. And that's a caregiver point most of the time, who's being your advocate. So who's being your advocate? They want to do you get a lot more with sugar than you do with vinegar, I think is kind of the way it goes. Yes?
I was just going to stress with regard to medication. My husband had advanced Parkinson's, and I always was there at the hospital and I could see what I needed to be. And not everyone has a caregiver who can come, but if you can at all have a friend or someone who can come for part of the day and tell them ahead of time. In addition to the timing problem with my husband's meds, he took one unusually large dose of a relatively less common medicine. And I looked over there, I'd given them the list of what he took. And you give it to them and then they say, well, we don't have this one, bring it from home. And this one they didn't ask me to bring it from home, but I noticed that they were giving him about 1/10 of the dose that he normally took. Mm-hmm. And I just happened to see that written on their chart, and I said, no, this isn't what he takes. He needs the 12 milligrams. Yes. And then they got me to go home and bring it in, but they didn't have it, so they just substituted a lower dose.
Right.
And that was his main medicine.
Yeah.
That would have been catastrophic. So.
Right. So having that advocate is the key, whether that advocate is the spouse, a caregiver, a friend. You really kind of have to, it's like designating, how many of you have done your advanced directives and you have somebody that's, your DPOA, somebody that's helping you make decisions. That's all things that we all need to do and do ahead of time. Because who knows, you get in a car accident, you trip and fall, lots of things can happen to end up in the hospital. Okay, so it's not anything to be taken lightly. In fact, today there was the PMD Alliance was doing a talk for people with young onset Parkinson's disease about hospitalizations, because you tend to think, okay, well, if I'm under 50, I don't have to worry about that so much. But yeah, things happen, right? My neighbor just texted me, and I knew she was going to a wedding on the weekend. Well, it turns out she got rear-ended by a semi on the way to the wedding, totaled the car, and she's lucky to be alive, right? So things happen. So be prepared. Pick an advocate.
I have a friend whose spouse has Parkinson's, and he went into this hospital for prostate surgery. Totally different reason for being hospitalized. Mm-hmm. Do you think he went home afterward?
No.
Yeah, so then I got the call, what skilled nursing? But the point is really important that you're bringing home to me right now for whatever reason someone is hospitalized with Parkinson's, all of this should be done.
Yes, yes. And if you, it's great if you have a planned surgery, like you need a knee replacement or you know you're going in for something. That's great because you can talk to the anesthesiologist ahead of time. There are certain medications that are, you want to be as lightly anesthetized as possible because there are issues with some of the medications interact more with your Parkinson's meds. So planning ahead is great. So you knew you're going in for prostate cancer surgery. You should have planned ahead, right? That's be prepared. Talk to your doctor. Have your neurologist know what's going on. They can talk to your neurologist. He just can't consult usually in the hospital. But they can pull in another neurologist. And I do see that a lot because I work in home health. I see lots of notes from hospital stays. And they'll pull in the hospital neurologist. And the hospital neurologist will know Parkinson's. But the surgeon is doing the prostate cancer. And you want to make sure that that anesthesiologist should have known ahead of time how to work with this person with Parkinson's. So that is really, really key. So when you follow that, where did I put my book? It's in here somewhere. This little book. All right? So I'm going to put this down. What pages? Make sure we cover everything. Talk about those things. So you got a medication form, you got a look card, take a doctor look to your next appointment. And then have them, there's what you can download it from the web. And I didn't bring a copy of it, but it's just another good thing to have in that book. Your emergency contacts. To me, your emergency contact list should go hand in hand with your medicals. Right? So who do they call? Is everybody on there who has an iPhone? That would be about smartphones. So an iPhone actually has a help option that has a way for a first responder to access your emergency contacts, your blood type, your medication list, all of that stuff. They can bypass the lock screen and get to that, and they know to look for that. And if you don't pull it out, it doesn't help them, right? So having that emergency contact list is really important. Thinking about if you have proxy cards or you all done your advanced directives. I've done mine, finally. Anybody else done their advanced directives? If you haven't done advanced directives, you need to have that no matter how healthy you think you are. It's really important to have that done. And then packing your Parkinson's and medication. And then having this in a place where it's accessible and easy to go. So if you wanted information for first responders, do you know where they look? Where they're taught to look? Do you know? Refrigerator. Right? So, I brought along one of these. And there are different versions of these medical alert boxes that are magnets, so they're supposed to be under the fridge. This is kind of that thing that you can have in your home that the vital life. So it gives you the whole list of medications, your emergency contact. It's something that they're taught to look on the fridge. So if you've got this on the fridge, that's great. When you have a emergency alert system, like a help by phone when I can't get out, like type of thing. Anybody have one of those? So especially people alone, that's a really important thing. So, having all these things, these are available, and it looks like these guys are actually, we have them to give out, so I can bring this.
The Area Agency of Aging just had a new batch of those printed, so I can get some to give out.
Yeah, so these are projects of the Area Agency on Aging. I think we're help funding it as well too. I never know what CCMG is all doing.
Some refrigerators don't take magnets.
Some refrigerators don't take magnets, but in that general facility. So if it doesn't take a magnet, then that's a little bit more challenging. But in that general vicinity, right? So can it go on the cupboard right next to it? That's where they're going to be looking. And it does talk in here, it is a reminder about how to package up those meds to take them. But the things are, it needs to be in the original bottle, it needs to have dosage, timing, your physician's phone and name, and be relatively current, right? So kind of keeping that up there. The iPhone, where did I put my iPhone? Yeah, so if you haven't done that, you could do that. Did you know about that, Jeannie? No? So I don't know where I put my phone. It is the health, the heart button. So let me find where my heart is. So when there's usually a white thing with the heart. And in it has medications, symptoms, body management, and you can have all of your, all kinds of things on there. And it is accessible. It has your, I don't know why mine's not coming up, but it has the ICE, so your family and friends that you can put. So find that. I'm looking for that. So I'm looking at the on your iPhone, there's a white square with a heart, a red heart in it. Can you find it?
Yeah, it's right on the front page for me.
Mm-hmm. Should be right. It should be on your front page. And then there should be in the top like your initials, and there's a medical ID. And in that medical ID, it says Maria Allen. I'm an organ donor. I'm blood type O+. It has my weight, my height, and my emergency contacts. It is enabled for emergency access, so they can find that. And then I could also have my medications in here. It's in that medical ID profile.
You have to set it up.
You do have to set it up. So that,
I didn't know it was there.
and most people don't even know it's there, okay?
And if you fall, it will alert you.
It will?
Well, some watches and phones do have fall detection in them, but not all. But this is just, there's health details, so you can put your name and your age, your medications that can be in there. Your medical ID is that emergency contacts, and then those emergency contacts in your contact list are listed as emergency contacts. So if I go to my contact list, right, and I look for, I'll go to the A's because I'm Allen. So my emergency contacts all have red. They're my emergency contacts. So they're noted on my contact list. Another way for people to find your emergency contacts. But the main thing is that medical ID is available to first responders without having to unlock your iPhone, right? Because you have a passcode to open it up, but that's available outside of that, right? So it's just a good thing to have. There are lots of things to think about.
I worked in the emergency room for several years, and one of the big things was everyone had their information in their iPhones. Oftentimes their phones were in the wrecked car or fell off the cliff or wherever the person came in. So they'd say, call so-and-so, what's their number? I don't know what's in my phone. And ever since that experience, I made sure that I and my husband both have emergency contacts, medication list, everything in our wallet.
Yes.
On us. So it's old-fashioned.
Yes.
But
Safeguards. You need all those safeguards, right? Because your phone may go flying when you fall and it doesn't get picked up. So yes, that medication list and emergency contact list in your wallets is key, but then you got to do better than my father-in-law who didn't even have his wallet on him when he shows up at the hospital emergency room. They managed to treat him, but that's like scary, right? So as well prepared as you can be. That's this, and having that advocate. If you don't have a spouse or significant other, then talk to a friend. This is somebody that needs to know. You should, my neighbors that are single, it's like, okay, I've got their list of their emergency contacts. I have an extra key to their house. We help each other out if somebody needs something. That's those networking kind of things, to be prepared of what you need to do, because things happen. So use all those tools to the best of your ability. We've got back, let's see. And then if we go, so it isn't very big to read. But this is where the challenges are, right? The Parkinson's Foundation is really working to try to change this from a national standpoint, that all hospital systems within their medical record systems have to have a way to flag Parkinson's disease, okay? I do that in my home health company. We flag our Parkinson's patients. That way, I know that they need to be seen by a Parkinson's therapist. I know that I can look at charts, I can consult, because I'm the one with all the years of experience, right? So, but if they aren't flagged, and sometimes Parkinson's, you may be like 5th or 6th or 10th on your list of diagnoses when you come out of the hospital. But even if it is your, down at the bottom of that page, it's important that whoever's caring for you knows you have Parkinson's, okay? So they're working with improving technology, standardizing the care, providing education. They're doing lots of healthcare education, which is really nice to see because that's been missing. It's been something that there hasn't been. Trying to transform that culture. A part of that is, too, it's not thinking of Parkinson's as a chronic disease that you have to manage over time and not this negative stigma kind of type of thing, right? It's just, you got to live with this like people with diabetes and with people with other chronic illnesses. You got to manage it well over time. And driving some policy change from a legislative standpoint, right? There's some great things. There's the physicians that are working with the Ending Parkinson's Disease and the PD Avengers, where they're really, it's like we're so far behind in dealing with this pandemic of Parkinson's. We still haven't even gotten rid of a lot of the pesticides and things that we know are, creating more problems with Parkinson's. So this is one of the things I really enjoy working with the Parkinson's Foundation about. And if you have questions, I'm here. Again, you'll each have, I'll leave you some more for and cards. So yeah, I'll give you some extra packets and some cards for people to get them themselves, and some Spanish ones as well too. Yes.
One question. Jean, you may have addressed this, but I couldn't hear you. I'm sorry. When Kit went in the hospital, they gave him an anesthesia for broke his hip, and it was nobody asked about it. I mean, I've gone through this before, 10 years ago or something, and but they gave him anesthesia that caused really bad psychosis. It was a lot of fun, but but it was really not okay. I'd like to not do that again. And I know about Haldol and all that. Are there anesthesias that you shouldn't take if you have Parkinson's?
Let me find that, yeah. So like as Versed or as light as possible is where they need to go. And there are some contraindications. Let's look at that.
Is that in one of these?
If you take any medicine that is an MAO inhibitor, and that includes Azilect, Selegiline, Racegiline, Azilect I think is fairly common.
So
if you have any of those so-called MAO inhibitors, you should need to tell the anesthesia.
So this is on here. This is what it says right here.
But it's really important to know before you go in the hospital, because sometimes there's an emergency and they're going to take you off or put you on the anesthesia.
Right. So if, this on the hospital fact sheet talks about the antipsychotics.
Are you on the medication form or the hospital?
Nope, the hospital care fact sheet. Do you have that one? And it says anesthesia. So if a patient, just like she said, is taking an MAOB inhibitor, Selegiline, Racegiline, which is Azilect, avoid Demerol, Ultram, Dopamine, all these things to avoid, halothane. If you're nauseous, right, they want to, the safe medications, they list them there. Then they tell you you shouldn't, usually they're going to give people Compazine, and that's something to avoid if you have Parkinson's disease, and Reglan and Phenergan. Those are the common things, and they're not good for people with Parkinson's. And even some, the antidepressants that are better. But it does become a problem because a lot of people with Parkinson's will have a short-term bout of crazy hallucinations, delusions, funny things because of the anesthesia on top of the change in environment and the immobility and everything else. And usually people will get better, but if they start throwing medication at you that is too much, that just keeps continuing down that spiral. Somewhere here, Dr. Okun had in his talk, let me find my notes. So the MAOB inhibitors, if you have the opportunity to stop them before surgery, that's best. Bring your own medications. See if you can negotiate when you take your meds prior to procedure. Use as little anesthesia as possible is always better. Always choose being awake if possible. Failing that, light anesthesia or anesthesia that can be cleared from your system as quickly as possible is always best. Get up and move as quick as possible. Your advocate's primary job is to bring all your medications in a medication schedule and ensure you get your medications on time every time. That's the main thing about the, he just basically said, use hospital lingo, talk about length of stay, be very positive, be a, a helper for the people in the hospital because they're all understaffed and stressed. But as light as possible, and the MAOB inhibitors, as you said, are the big thing there. Being in the emergency room is completely different. Make sure Parkinson's doesn't usually change really quick. Usually if you have a really sudden decline, more often than not it's an infection, like a urinary tract infection or a pneumonia, or you have something going on with your meds or something else, right? Some kind of side effect, or maybe you've got COVID. COVID's going around again, huh? So really understanding those kinds of things that, I don't think but that was it. Just light as possible, things that clear your system faster. Make sure you've got an advocate. So I will leave out this stuff. If anybody has any other questions, make sure you each have a kit, and I'll leave you some extras. People can get them on their own if they want more for their friends. And hopefully it'll get better soon. The Parkinson's Foundation is working hard on this hospital issue. So, thank you.
Great.